Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
There's so much in the news about health and wellness, and that's the challenge. As many of you have said on this program, that wellness is what it's all about, and how do we prevent disease? Not so much how you treat disease, but how you prevent it. And you can start wherever you want to, but this is an interesting aspect of it in terms of our affectation with glaucoma. We have a higher risk for glaucoma and a higher risk for advanced visual loss after glaucoma diagnosis. And one of those things is that we're not too often getting our vision checked every other year as we should, especially as we age. And so as a consequence, the diagnosis of glaucoma. What does glaucoma mean? Glaucoma means that you have a high pressure in your eyeball that compromises the retina, which is what allows you to see. And so when that pressure squeezes the retina, it causes hemorrhages and decreased circulation. And as a consequence, you go blind unless the pressure is reduced. And so we have medications to reduce that pressure, and we also have surgery that reduces the pressure. And hopefully I'm going to have one of our eye doctors come in and talk to us about that very soon. That is one of the things that is affecting our population. And it's interesting, again, in their studies, it made up only 2% of the study population. But in spite of that, they were able to identify how we suffer from glaucoma, and when we get the diagnosis made, it's often so late that it's a common cause of blindness for older people. And so it's important. Therefore, I guess when we talk about an ounce of prevention, it's important to get your eyes checked about every 2 years, especially after you reach the age of 65. Whether you have symptoms or not, because often early on, they don't have symptoms. So cataracts, of course, you will have symptoms and you'll lose your vision slowly, but the difference is with cataracts, it's easily treated, relatively easily treated. Whereas with glaucoma, it requires eye drops and often also additional surgery.
Dr. Callender, what are the symptoms?
No symptoms often, but if you wait late and you'll have halos around objects, and you'll have inability to see things on a distance, so that's one thing. But it's wise is not to wait for something, but to get your eyes checked every 2 years and get your blood pressure, your intraocular pressure checked, because you want to have it to be in the low teens rather than high.
I had both parents had glaucoma, and I'm diabetic, so I get my eyes tested every year.
Good. So those of you who haven't gotten your eyes checked, it's something that you should do regardless of whether you have symptoms or not.
I have
because as we talk about the many gifts of the world, the sight, vision, taste, touch, those senses are our wonderful gifts to us that we need to take care of as much as we can. Because as we age, that preventive lifestyle becomes more and more important in terms of allowing you to be mobile and able to see and hear, touch, taste, feel.
And Dr. Callender, as a scuba diver, I have to get my eyes checked every year, and I also do the visual field. And so far, I'm good. But I am a glaucoma candidate. That's what's on my record. It says a candidate. So, and my wife and her father have to take those drops to help lower the pressure.
Yeah.
So far, I'm good.
Okay, any other comment? And those of you who aren't getting your eyes checked, get them checked. Okay. This we've talked about exercise ad nauseum, but I guess, as we talk about an ounce of prevention is worth a pound of cure. This is another way in which you can have a lengthy life and a life that's associated with a decrease in illnesses. And we've talked long about the fact that 150 minutes is a minimum, but you can actually do 2 to 3 or 4 times that much, and it will have benefits. And one of the things that I emphasize is that when you exercise, if you have pain, then you should stop. But exercise will enhance your life, increase the length of time you survive, and also decrease the amount of morbidities or illnesses that you go through. And if you have illnesses, it also better helps you to get through those illnesses. 30 minutes a day seems like a lot if you think it's a lot, but it's actually a worthwhile investment. And as they look at the way in which you can accomplish the 150 minutes, there are many ways you can do it. Some people do it over the weekend. Some people do it daily. Some people do it all at once. But it's whatever way you do it, to allocate 150 minutes per week is something that is everybody should be involved with, especially after the age of 40. And this is looking at how some people do it over weekday activity and weekend activity. One thing that is clear, we're not close to 100% of the population being involved with exercise. So it's something that, as you see here, less likely to die and less cardiovascular disease and less cancer as well. So, and this is an interesting graphic which looks at the deaths from all-cause mortality and cardiovascular disease compared to those people who exercise and those who do not. So you can see there's a very graphic evidence that exercise is something we should all be involved with, whether we can walk or do gardening or whatever exercise we choose to do. And we talked last week about the fact that even 10 minutes is better than no minutes. So that it's something that we all can do. We don't have to all do it the same way, but we all can do it. Any comment or any of those who like to do it over the weekend or those who like to do it never? Because that's a category that still is there, even though we know that it's the thing to do. It isn't always a thing that we do. So, and sometimes you wonder if we overdo talking about exercise, but I don't think you can do that any more than you can overdo talking about an ounce of prevention is worth a pound of cure.
Dr. Callender, my exercise routine is, pretty well established, but that's really because I'm retired. I think it's probably a lot harder. That's why you have a lot of people who only do it on the weekends, who have these 9 to 5 jobs. It's pretty hard to get a daily, weekly routine, exercise routine in. But that's why a lot of people use the gyms and things like that, I guess.
Any other comments?
Yeah, can you hear me?
Yes.
Oh, okay. I was having some technical difficulties this morning. But my comment for anybody who's working or not working and say they don't have time to do this or that, my question would be, how much time do you spend watching TV every day? Because if you watch TV, you got time to do whatever you want to do.
Take time to live. Yeah. Yeah. And the sicker you are, the more illnesses you have, the more important exercise is. So, but it's a matter of discipline. If you recognize that it's a priority and you decide to set aside the time to do it, it's valuable. Another comment?
Another one was that they said that men exercise more than women. I thought it was just the opposite. I don't know unless you consider housework, I don't know. What does this panel think about women exercising less than men?
I think it's irrelevant. I think all of us need to exercise.
But in this article, they say that men exercise more than women. Yeah. But somehow women outlive men.
Yeah.
I think that used to be the case, that women would exercise more, but nowadays everybody try to be healthy. And as Dr. Callender said, you can do it in different ways, but gyms are popular now. And I think men and women are about the same. At one time, yes, I agree with you, Carol, that women would exercise more. But I think it's about the same. Everybody should be. And I'm not one of those. I don't exercise as much as I should, and I admit it, but I do exercise. But I think it's pretty equal.
Well, I think, there's a lot of ways that women may exercise that they may not get credit for. Sometimes people forget that the gardening is a great exercise.
Mm-hmm.
Some of them do gardening and don't go to the gym, but they do gardening, and that's a great exercise. Walking is a great exercise. So there are many, many ways to do it. Yeah.
Housework too.
Yeah.
Housework as well. Yeah.
But this graph is showing us something different.
Mm-hmm.
Right. Mm-hmm. Right.
It's not a lot more, but it is more for men.
Yeah. Right.
Well, when you, good morning again, everyone. This is Elizabeth. I do agree with everyone has said, but I do take under consideration, like when I deal with the categories, there is a special category that says sports performance. And
what did you say? What's the category?
The categories that I deal with, one of them is sports performance.
Oh.
And so when you take off all the sports players, when you consider all the sports players and all those people that are interested in that area, like my son, he loves sports all his life. And he got back in, he's always played off the weekend sports and stuff. But when I coach people, it's always the men, and I attract them through the exercise of sports performance. And there are more of them requesting that than there are the ladies. Now, I won't tell the story about the ladies, but that's how my scale tipped over towards the men. Because when they see sports performance, they want to know, okay, what is it that I can help them with?
This is another aspect of it. And, you know, one of the things that I recognized is that as you aged, a lot of older people had a lot of pain, not only from arthritis, but also from muscular pain. And one
And
of the things
joint
that
pain.
one of the things that joint pain, yeah. One of the things that I recognized was that I had a lot of knee joint pain, and so I started exercising. As I started exercising, the pain went away, and it became less and less. And so, for chronic pain, for some people, now that doesn't speak about for everyone, but especially if arthritis is an issue, exercise is well known to decrease the amount of pain in arthritis. So it's one of the things to do to increase your lifestyle, but also to help you to eliminate musculoskeletal pain. Sometimes it is unappreciated, and for some people, they stop exercising because of the pain, when in point of fact, that may be a good reason to actually exercise. Dancing, which we all know how to do, walking, stretching, and gardening are activities that help people. You know, I recall when I was much younger, seeing a lot of older people talking about pain they had from arthritis and other things. And many of them didn't realize that the exercise would help reduce that pain, if not eliminate it. And as I gave people advice about it, few people would actually believe it or take advantage of it. What are your thoughts about it? Any of you use it to help you with your arthritis or the pains of musculoskeletal pains associated with aging?
Yes, Dr. Callender.
Yeah.
Yes, I do. And I do encourage, there are two types that, in addition to not in addition to reference to what you just said, the aerobic activity and the muscle strengthening activities. And when I retired, and you know, as teachers, we do that walk, talk, and chalk. So we're constantly on our feet. And so when I retired, it was less constantly on my feet. And all of a sudden, I heard knee cracking. And when I was going upstairs, and I decided, oh no, this is not happening to me. And so when I went to the doctor, he said it was a form of arthritis. And I said, oh no, this got to go. This got to go. And that's when I went into I joined the wellness center. And we had a coach. It was a female at first. And then I joined the guy because the female left. But he coaches us Monday through Saturday. And I don't have those joint pains because with the muscle strengthening, it increased the skeletal muscles, strength, the power, the endurance, and the mass. It helps to work out all those muscles, skeletal muscles groups, such as the shoulder, the chest, the tricep, the bicep, the abdominal, legs, and the back. And I've had clients that I've worked with, but everything has to be approved by the doctor, okay? Because we're not medical people. We're just, we're lay coachmen. And so I've helped a lot of people that where that pain doesn't exist. But one thing I do insist, I'm not gonna coach you if you're not gonna follow the 5 pillars that I say. And one of the main pillars is exercise.
Yeah, you know, it's any other comments? Because
I don't know if people actually exercise more. I really think they do. But when you go out in the street to the grocery store or any store, exercise apparel is popular. Everybody wears exercise apparel, and you look and you wonder, are they coming from the gym or are they going to the gym?
Yeah.
No, they just wearing the apparel.
They just wear the clothes.
Dr. Callender, previously you said if it hurts, don't do it, if it's too
Stop.
much
I
pain.
said stop, yeah.
So if you already got pain and you gotta exercise the pain away, so how do you do that?
Well, no, what I said is when you exercise, sometimes that exercise, you take it to a limit where you hurt yourself. Now, it is clear that exercise will eliminate or decrease the amount of pain that you have from arthritis and other things, as Elizabeth mentioned. So we're talking about it in two different dimensions. I'm talking about it so that when you exercise, you can take exercise to the point where you hurt yourself. And so if you exercise and you get to the point where it's painful after you start exercising, then you should probably stop. In other words, if you're exercising whatever you're exercising, when you get to the point where that exercise causes you pain, we're talking about that exercise causing you pain, then you should stop. Not saying that pain is a reason for you not to exercise, because pain is a good reason to exercise.
Dr. Callender, we've talked about atrophy as a natural phenomena. And can you mention about bone density decreases as you age? Is that true?
Yes, it is. And also, as you mentioned, one of the commonest causes of death in people over 70 is falls. And a lot of that is related to our muscles atrophying, as you mentioned, and us not exercising. Strengthening those muscles, as Elizabeth had mentioned, becomes critical to keep your muscles strong and from the natural consequence of aging, which is the muscles weakening. And so it's really almost mandatory as you age that you exercise, because otherwise Elizabeth's description is exactly what we all have to go through. And one of the ways to decrease that is to have an exercise routine that you go through every week.
Dr. Callender, I take medicine to increase my bone density.
Yes, of course. And as you pointed out, that there are medications, especially like vitamin D and calcium, that become important in order to keep your bone density, which is a separate entity, because as we age and as our diets are deficient, and we're deficient, as Darryl often mentioned, with getting enough sunlight, we then have osteopenia, which is the term, or osteoporosis, which is something that we will get if we don't exercise, and sometimes in spite of our exercise. So that, and this then, of course, takes us on the role of vitamin D, which is part of the treatment for osteoporosis and the prevention of demineralization of the bones, which does occur along with old age.
I have a pinched nerve in my back, but I still walk. I can't do a whole lot of different exercises, but I do walk.
Well, that's and I think I'm going to try to see if we can get a neurosurgeon to talk with us as well, because a disc is what happens when the nerve comes out of the spine and the bones squeeze against it, and then you get the disc. You have pain down the back of the leg and the thigh, and numbness of the foot, and of course that requires special treatment. Sometimes special exercise, lengthening and stretching, and sometimes even surgery. But I think exercise helps even that. And there are special exercises that the physical therapist will take you through to help some of the pain that goes along with the lumbar sacral disc disease that becomes a problem associated with our aging, getting arthritis of the bones and the spine.
Dr. Callender, does the amount of inflammation that you have in your system, does that affect your arthritis and the pain that you receive?
Yes, it does, and that's why exercise is part of the treatment for it. But I think so many things are associated with inflammation. Even obesity is associated with inflammation. So, and then of course arthritis is nothing but inflammation of the joints. So that and that's why when Elizabeth talks about increasing your immune ability by diet and exercise and other things, the anti-inflammatory nature of those things is what helps us.
Thank you.
Now, this is a study on the fact that high dose vitamin D pills, in other words, getting your vitamin D level checked and finding out whether you have a low vitamin D level, it becomes important. Because if your vitamin D level is okay, you don't need to take additional vitamins. But if your vitamin D level is low, then you do need to take vitamin D. Now the question is, how much vitamin D do you need to take? Because some people are suggesting more than 5,000 units a day. And sometimes it is important only to me if you are vitamin D deficient, and many Blacks are vitamin D deficient. And so the desired thing to do is to get out into the sunlight and let the sun help you with it. But some people can't do that because of morbidities, and as a consequence, they will need to take a certain level of vitamin D. But more than 2,000 to 5,000 units is probably much more than you ever need to take.
Dr. Callender, I noticed quite a while back they started adding vitamin D to the milk, and that's one comment. The other comment is that my doctor never had a test for vitamin D in my screening, my annual physical screenings. I had to ask her to to test me for vitamin D, because it was possibility there would be an issue with aging, and she did, and I was okay. But they didn't even include that in my blood testing. So,
well, most of the doctors who don't deal with a lot of Black patients aren't sensitive to some of the things that and the problems that we have that are unique to us, including prostate trouble and other things. So that's true. And so we've found many Black patients to be vitamin D deficient, which is some way related to renal disease and other disease problems, along with osteoporosis and osteopenia. And the role of vitamin D and calcium then becomes important for them.
So you recommend that we all get tested for vitamin D? Because I don't think it's a regular.
I think all Black patients should. That's my opinion. Yeah.
Mm-hmm. Okay.
My doctor just told me to start taking vitamin D and calcium tablets. I don't think I was tested. I'll have to ask her whether she actually tested me, but
yeah,
she just, as I age, she just.
Yeah, most doctors.
Mm-hmm.
Yeah, most doctors think that this will decrease the likelihood of you getting broken bones and so forth, because that's what happens when you're osteopenia, when your bones are, we have osteoporosis with the bone is softening the bone density. That's why you have bone density tests that you can take that will tell you whether your bone density level is normal or not. And these are good ways to identify. The vitamin D level is one way. The bone density test is another that tells you whether you need to be taking those medications that will keep you from breaking your hips and your other bones that occur with aging. Now, this is a problem in that as they looked at the prevalence of cardiovascular disease, they projected that as time goes on, this will become even more and more of a problem. But the thing that is disturbing is that they particularly pointed out its prevalence in the African American population compared to the white population. As we talk to the Black, Hispanic, and Asian population, it markedly increases in those populations, but decreases in the white population. And so this means this is related, no question, to the diabetes, hypertension, dyslipidemia, and obesity. As that increases, those disease entities increase. And then you get the heart disease, heart failure, stroke, etc. And so this is something that we can all address by better nutrition and by exercise. And it's something that this steep increase that they call it is something that we can avoid by adopting a healthier lifestyle than we have in the past. That's why all of our efforts with our MOTAP efforts have been involved with emphasizing the importance of adopting a healthy lifestyle, increasing exercise, increasing meditation, increasing
unknown caller
plant nutrition efforts. Somebody want to make a comment? Okay. Well, anyway, I think this is something for us to be aware of and to educate our children and our grandchildren that they've got to adopt these healthy lifestyle practices because it's in their best interest. Because as they age, it becomes more and more of a problem. And it then emphasizes the importance of an ounce of prevention is worth a pound of cure. Old adage, which is truer today than it was yesterday. Any comment? Kind of frightening and scary and it's something that education will help. So educating our children and grandchildren becomes something that we have to do, whether they like us or not. Now, as we know that the United States is going to be, majority is going to be the minority over time as well. So we're going to be an unhealthy nation, which we already are. We'll just be unhealthier than we were before. Now, there's no comment on that. This is fatty liver disease is becoming the commonest cause of end-stage liver disease. It used to be hepatitis C. Now we have the cure for hepatitis C. And so fatty liver disease is becoming the #1 cause of liver disease in the world. And fatty liver disease is associated with obesity and type 2 diabetes. And this study is suggesting that improvement in sleep quality would reduce it as well. This is one of the first studies I've seen that demonstrates that sleep plays a role in reducing fatty liver disease. One of the things about fatty liver disease is that non-alcoholic fatty liver disease is reversible. But once you get the end form of it, where the fat has replaced the liver disease, then that requires liver transplantation. And so here again, we talked earlier that it's desirable to have between 7 to 9 hours of sleep a night. And so those people who aren't able to sleep have a increased predilection to fatty liver disease.
I had a comment about this one. Back to the other article. I take issue with the title. I feel like that's a pretty broad statement, or at least the undertitle. People who stay up late. Okay, I can understand that. But they're saying also people who snore and nap are at a higher risk. I'm thinking that naps are good. It helps to supplement sleep. But are they're saying snore and nap are at a higher risk for fatty liver disease? I don't know. It just on its face, that doesn't seem like it. It's too broad of a statement. What are your thoughts on that?
Which thing? The fatty liver disease is a term that is used because fat replaces the normal liver cells, and that's why they call it fatty liver disease. They just point to the fact that they have observed that people who spend a lot of time napping and people who don't sleep well seem to have more of this disease. And then, of course, we know the snorers, which many of us are, especially those who have obstructive sleep apnea, are more likely to have many other problems. And they're the ones who don't sleep well and who have daylight naps. So those people who don't have obstructive sleep disorders and who nap a lot, then there may be other causes. I think this is just an observation that they've made. Whether it's the cause or not, or whether it's a consequence of other comorbidities is what I think is the issue. That we know that people who have obstructive sleep apnea are the ones who don't sleep well, and they also nap during the day. So that may be one of the reasons why this occurs, and they just have not identified and defined what are the factors in these particular patients.
And at the bottom,
That's my take on it.
At the bottom of the screen, it says prolonged daytime napping. And we've had articles in the past that have said if you nap more than 1 hour, it's not healthy. And so a person that's only sleeping 5 hours during the night and takes a 2-hour nap, they're into the unhealthy prolonged napping range.
Yes, and if you go down a little further, there's a paragraph that talks about the limitation of sleeping, of napping. It talks about 30 minutes and et cetera.
That's all I saw on this side.
Well,
Yeah, it is an issue that we're learning more and more about, and we learn more because now that this is now becoming the #1 cause of end-stage liver disease. This does not mean that alcoholic liver disease is going away, because it's not. Still very common, but it's just that this is replacing it as #1.
There it is, snoring and daytime napping for over 30 minutes. So that's that 30 to 60 minute range.
Yeah, but I think most of the studies that Darryl is talking about, it suggests that it should not be over an hour. Most of the studies have suggested anything more than an hour is not good for you.
Yes.
Yeah, Dr. Callender, you also have to consider your bed mate. If your bed mate snores and has sleep apnea that's untreated, you don't get a good quality sleep either. So that can cause you health problems, right?
Yeah, that's right.
well,
No argument there. No argument there. That's true. Yeah.
Is it that much of a difference of a person who sleeps at night as opposed to a person who sleeps in the daytime? And I'm thinking about people who work all night,
I don't
like
think,
I did for 30 years.
there have been studies that have been equivocal about it. I think the importance is that you get 7 to 9 hours of sleep every
Period.
24-hour period.
Okay, okay,
Whether it's night or day, I don't think it matters.
okay. That helps.
Now, this is a subject that we've talked about, and I think Darryl has emphasized it more than anybody else, but it's clear that most foods are actually processed. Some are processed more than others. But this just points out that the ultra processed foods have more of the inflammatory qualities, and the more natural foods actually have the anti-inflammatory qualities, and naturally. And this is something that, but actually, when you look at it, most of the foods that you see advertised on television are the ultra processed foods. And they are the ones that are easily, very accessible, and everybody knows about them. And so they are, in essence, not healthy for you, but yet these are the ones that are always advertised. And they talk about the things we like candy bars and pizzas and fruit snacks and those kinds of things. These are the 57% of the calories eaten by American adult, and 67% consumed by teens and kids are ultra processed. And so this leads to heart disease, which is, of course, the leading cause of death in the world, not only America. But I think what this study is also pointing out is that this has led to cognitive decreases, and that when you look at the cognitive scores, you find that this may be one of the reasons why overall cognitive test scores are lower.
What do they mean by breakfast cereals? I saw that with the bars. Could you go back it up where they had breakfast cereals?
They said all cereals. That's what they said. Yeah, up at the top.
The hot and the cold, or just the cold cereals?
Oh, I assume they mean the cold cereals, but I don't know. It just says breakfast cereal. And it doesn't go into any detail to explain what it means by breakfast cereals. Because we know we're not talking about the oatmeal and the other things that I think they're talking about the so-called fast breakfast.
So cornflakes and Raisin Bran is really bad for you?
That's what they're talking about, yeah.
Without the sugar?
With or without the sugar, right.
So to have smarter children, you don't give them cold cereal in the morning.
Well, that's what they're saying is that the more of that you have, the less likely you have a healthy lifestyle. They're not telling you to stop. You know, at the bottom line, they talk about it. They say that, however, the more that you deal with these foods, the less likely you are to have great cognitive abilities, and that they are talking more about the plant-based diets than the UPF diets, as they call them.
Hey, for all you oatmeal lovers that are trying to defend your precious oatmeal, Google says plain oats, cornflakes, and shredded wheat are minimally processed. But when the manufacturer adds sugar, flavorings, or colorings, they become ultra-processed breakfast cereals.
Thanks, Darryl. Okay, good. Yeah.
So oatmeal is bad for us?
It's less bad.
Back away from
What about cream of wheat?
back away from the
I I suggested old-fashioned oatmeal. That's the only thing I use, old-fashioned oatmeal. This quick oatmeal, this instant oatmeal, no, get as close to nature as possible. When I talk to people that I'm helping, I tell them stick as close to the perimeter of the store as possible. Because when you go in the area of the store, you're dealing with preservatives.
I was gonna say, speaking of preservatives, I was gonna give a blanket statement. You guys let me know what you think. The longer the shelf life, the worse it is. Shorter the shelf life, the better it is for you.
An interesting perspective.
Hmm.
I go along with that.
Yeah,
Naturally.
yeah. Because the less the processing.
Exactly.
Good to see you again, Mark.
Thank you.
Now this is and it seems like they have diets come out every other month or so, and this is a diet that came out that made people think that it's a lifestyle plan that everybody should do. And there's been a lot of discussion about the MED method. I had never heard of it before. But I guess the bottom line is that the diets that are healthiest are the diets that are less meat-based and more plant-based. I think that's a generalization that works. If you got a meat-based diet, that is healthy. If you got a plant-based diet, it is what she says. That was her method. I don't think that many people will subscribe to that, but that's what she said. And I think at the end of the article, they point out that more important is getting sleep, incorporating a healthier lifestyle into what you do. Acupuncture and nasal treatments are something that most people are not aware of, although acupuncture has been getting more and more positive feedback in terms of it being healthy. In terms of the probiotics, that's another story. And you see as much for it as you see against it. So I guess the bottom line is there are all kinds of fads, and you can choose your method that works for you. But I think the best diet of all is a diet that incorporates less meat and more plant-based emphasis, which is what the healthier diet should do. And then, of course, not taking away the importance of exercise and meditation and other aspects. But
I got a comment. Here's some famous black vegans for you: Steve Harvey, Beyonce Knowles, Colin Kaepernick, Serena Williams, Venus Williams, Stevie Wonder, Russell Simmons, Erica Badu, Taraji P. Henson, John Sally, Angela Davis, Kyrie Irving, basketball player, Cory Booker, Senator Cory Booker from New Jersey, Carl Lewis, the track star, Ron Finley, John Sally, the Detroit Pistons basketball player, and the list goes on and on. So hope y'all want to be like somebody in that list.
I want their money.
Somebody to cook for me.
Yes, that makes a difference.
Amen.
Okay, all right. Oh, yeah. Biden test positive again, just like Tony Fauci, and so he's relatively asymptomatic, but he's and infection and reinfection is something that we're learning to deal with.
They say the
Absolutely.
medication, the
What?
medication is what made them test positive again.
No, the medication is what made him test negative, but there was a rebound after he had that. And same kind of thing happened with Tony Fauci. He just mentioned that those are the people who are vegans. He's showing a long list of healthy athletes and celebrities who are vegan
So,
enthusiasts.
Dr. Callender, did they determine with Fauci and Biden that the rebound was from their own previous infection, or was it somebody else
As
that?
a rebound. Well, they haven't determined it yet, but it seems to me it's just the same infection. Bounce back.
I've heard the news refer to that as a Paxlovid rebound.
Yeah, from the medication.
Yeah, maybe he was over medicated.
No, I don't think it was. I think it's just a phenomenon that occurs with Paxlovid.
Yeah, they say that these things aren't 100% perfect. These vaccines.
Well, you're right. None of the medications are 100%, but I think Paxlovid is about 90%.
That's not a vaccine, though. Paxlovid is not a vaccine.
Right, it's not a vaccine, but it's 90% effective at eliminating the COVID virus.
It's a pill.
Yeah, well, he was in that 10% that had the rebound.
Right, yeah.
And plus he had monkeypox on top of that.
He does not have monkeypox, so not circulating that bad rumor. Now this is an article that talks about the effect of. No, Darryl is not trying to convince you to be vegan. He's just trying to convince you that it's healthy to be vegan. That's all.
Well, thanks for that. But yes, I actually am trying to convince everybody to be vegan. If it was up to me, I'd force you. I'd take the meat out of the stores. You'd have no choice.
No, he shouldn't be, because it's freedom of choice.
In my world, I'd be king and you'd have to do what I told you.
Thanks for the vote for democracy.
Dr. Callender, meat has a blood product that you can only get from meat.
That's
that we
correct.
need. That we need.
Well,
I got
that's another debate that goes on forever, because some people have suggested that there's ways you can find everything that you get in meat. Now, I don't know anybody who's been affected by hair loss with COVID. Do you?
Not me.
Because some of us didn't have hair to start with, so. But they are finding a significant percentage of people who have had hair loss that is something that is relatively uncommon, but it's something that we need to be aware of it anyway. For the men, it's not so bad, but for the women, it's a concern. What about you women out there? Have you seen many women with hair loss after COVID? Anyway, it's something that is now being observed in some population. As we time goes on, I guess we learn more about that. Now, this is an important article because the United States is going to pay for COVID booster shots in September, which is just around the corner, by the way. And it points out that Moderna is, as well as Pfizer has identified creating the vaccines boosters for the fall. And the fall is just next month. So those who haven't already gotten their second booster shots, if they haven't taken them yet, they might wait until September, because they will have Omicron adapted vaccines, which the other vaccines don't have. So anyway, this is important to know, because it was speculated that the booster vaccines would not be paid for by the government. And it looks like that is not the case. What is interesting is that still 130,000 new cases every day. And we still have, go back to the previous article, please. And we still have a number of people who are getting the virus and people who are dying every day. And so it's not past history, it's current events. Do you still know people? I just encountered at the National Medical Association one of my colleagues who has asthma, and she refused to be vaccinated. And for that reason, she couldn't go to some parts of the convention because they won't accept you if you're not vaccinated. Are you encountering many people who are still refusing to be vaccinated? Any of you encounter your children or grandchildren still deciding not to be vaccinated?
People in Florida.
Yeah, I've run into a few people who are refusing to be vaccinated, and they haven't caught COVID yet either.
Yeah.
There's an article about that later.
Yeah, that's what this all talks about. Those people who have not been vaccinated, who have not caught COVID, but who also may have genetic and immune systems that are protecting against the virus. And so they're suggesting that those are the people who need to be studied, so we can find out what makes them immune to this disease. And there are genetic things like interferon and other things that may be protective. And so we can learn from them perhaps what are some of these factors that allow them to be immune to this virus, which has affected 70% of the American population already.
I've got a friend who refuses to take the vaccine. He's had COVID twice. And the first time it was mild symptoms, the second time, no symptoms. And what he does is he drinks Jack Daniels all day. I'm serious. They could study that. Maybe
That's a new cure for coronavirus. Jack Daniels. How's your other friend who was on dialysis?
He's preparing. He's what do they call, high up on the list. He's about to get a kidney transplant.
Oh, he's back on dialysis?
Yeah, he's on dialysis. Oh, well, you're okay. You're probably thinking about my cousin. My cousin still off of dialysis, but I've got another friend who's been on dialysis 5 years, and he's about to get a kidney transplant. My cousin Rodney is not on dialysis, but he's still on the kidney transplant list.
I see. Okay. All right.
So, Dr. Callender, how do they determine that someone who had no symptoms had COVID?
Oh, you can do antibody tests. That's how you determine.
Okay, why would somebody even take an antibody test if they've unless they want to volunteer for a study. I mean, if you didn't have any symptoms and you didn't even know you had COVID, why would you even want to take an antibody test?
I don't know.
My friend, the second time he had COVID with no symptoms, he spent the weekend with people where everybody came down with COVID. And so as a precaution, they told him, hey, we all have COVID, go get tested. He got tested. He had no symptoms, but he took the antibody tests and they said, yes, you have COVID. And so he isolated for 10 days.
That's a good reason.
Yeah, but he knew he was around people that had it though. Yeah.
Actually.
But probably they caught it from him.
Could have. We call him Typhoid Mary.
That's terrible.
Yeah, your friend that drinks that Jack Daniels, he might not get COVID, but he might get liver disease, cirrhosis.
Mark, we did not discuss the relationship of marijuana to COVID. We haven't seen any articles that actually, if you have some, you can send them to Buchanan so we can look at it and discuss it. But we've not yet discussed the relationship of COVID to marijuana.
I think this is the issue right here.
This is interesting how that some of the breast cancer drugs knock down, decrease COVID risk as well. But there's so much about COVID that remains for us to fully understand. And this is it, talking about the gene changes that allow increase the risk of hospitalization and those that decrease the likelihood of an infection. And so these are aspects of COVID that we need to find out about and perhaps use to help those groups of people that are not vaccinated who can be infected. Because people are still being infected and dying from COVID as we speak.
Dr. Callender, I know that I know individuals who have not been vaccinated, but they're not going anywhere. They may go to the store when it opens and get in there and get out of there, and they're just not mingling and fellowshipping, which I find is strange, but that has been one of their vehicles that they use.
Yes.
To actually, saying I'm not getting vaccinated.
Yeah, that's a way. That's one way.
I'm just looking at an article that says that the active ingredient in cannabis inhibits infection of SARS-CoV-2 in cells of mice. So it doesn't look like a lot of extensive studies in human patients where marijuana could inhibit the spread of COVID, but possibly, but just not enough studies, probably because after they've taken enough marijuana, they got the munchies and couldn't continue the study.
Sounds about right.
Dr. Callender.
Yes.
I saw earlier in this very article you are showing something about OAS gene therapy for this COVID. Can you tell us more about it?
No, I don't know anything. I don't know anything about it. That's very new, and I'm not familiar with it at all.
Okay.
Yeah.
Yeah, just passed it. There it is. Mhm.
But I think as they study, they will find out that there are certain genetic genes that may protect and genes that will make it more easily for you to become infected and actually die from COVID. I think interferon was one of them. those products that was identified early on. This is the gene you're talking about, but
Yes. OAS
but I don't
one.
know anything about it.
Okay, thank you.
This is monkeypox has been a source of discussion for at least the last month or so. And I think this dermatologist explains the lesion of monkeypox, which is a virus very much like the smallpox virus. The difference is that it's not as infective as a smallpox virus. And also it is spread primarily by you touching somebody who has the virus. It also is associated with, so far, 98% of the cases that have occurred in men who have sex with men. And it's interesting for those who have a historical perspective that is kind of how HIV started out, with men who had sex with men. And then it is also now known that it can also be spread by women to their fetuses if they get pregnant. But anyway, the fact that it's a rash, and that it's a rash that if you touch others with that rash, wherever it is, whether it's on the mouth, whether it's on the penis, whether it's on the vagina, or in the anus, this then can cause you to have monkeypox, and that the lesions usually associated with vesicular rash, which means that fluid may come out of it and you can ulcerate. And now it's interesting, they say delay getting medical attention. The problem is that they don't really have good treatment for it right now, and they don't have enough vaccine. So it's avoiding it is probably the better part of everything. And if somebody has a rash or bump on the skin, they should contact the dermatologist and have it evaluated. It's unlikely to be monkeypox, but unless you've come in contact with somebody who has monkeypox, but it is something. I think there were 122 cases in DC already, and I think the United States is the largest country with more people with monkeypox than any other country in the world so far. So it's something that has been declared an emergency. And I think some people are disturbed because of the fact that it is primarily a disease of men who have sex with men. And anyway, any other comment about monkeypox?
Yeah, I was thinking, well, you can't do the fist bump anymore.
Well, you can do a fist bump with those people who don't have rashes. But it's desired to do it with gloves on.
Oh, no.
Any other comment? Yes, skin to skin. Mm-hmm. This is kind of frightening to find that polio was found in New York wastewater. And some people in the state were urging vaccinations, but all the kids are vaccinated. All the kids that go to school are vaccinated. So the question is, what are we to look for in the next month or so? Is polio going to come back? Well, it can come back in those people who've been vaccinated, but those who haven't been, then, yeah. And this is a line that's important to look at. There's no cure, and it can cause irreversible paralysis, but the vaccine has been effective in nearly eradicating polio. It's interesting because most of us have not seen polio. And most of those affected are age 3 and younger. So it's interesting how Jonas Salk made a major scientific achievement, and it's going to be interesting to see if it's actually coming back, because it's probably coming back in those people who have not been vaccinated, which is not too many.
One of the biggest problems is that the latency period of 30 days. You know, you could have it and spread it for 30 days before you even know you have it.
Yeah. Mhm. So that's why it's so important that the kids get vaccinated, you know.
I hate to do this. I had a question about the monkeypox vaccine. They're saying that there is a national shortage.
That's
of
correct. Yeah.
vaccine.
Oh,
So,
yeah.
do people who get it get vaccine, or do people who want to prevent it get the vaccine?
People who want to prevent it get vaccine.
Okay. But what's the treatment for people who get it?
Well, the treatment is they do have a medication. I forgot what it is now. They don't talk about that much. And I don't know the name of the medication that they use for it.
Darryl?
Well, you're thinking I know the medication for treating monkeypox?
Yes, sir.
No, I don't. But I'll be glad to Google that for you.
That's what I was suggesting.
Okay.
One more.
Dr. Cal, one of the concerns was, and one doctor gave an interview, and they were talking about to be careful with hotel bed linen.
Well, I think that if you have linen that is infected with the virus, that would be a situation. That would be something that the hotels would mean they're not washing their linen. But anyway, so far I've not heard of that as an actual causative factor. It's more of person to person, skin to skin, rather than, yeah.
Google says tecovirimat is the antiviral drug that's being used to treat monkeypox and smallpox.
Thank you.
Apple is getting rid of passwords from next month, which is an interesting development, because that means that down the road, we won't have to worry about passwords. But that's only going to be available for Apple products. But it's thought that it will quickly go from Apple to other places, so that eventually down the road, we won't have to be worrying about passwords, which will be good, because right now people are making a lot of money off of hacking into systems because of passwords. So I thought it would be good to know that down the road we won't be victimized by passwords as they have. I guess this is a major industry for some people. There's so many different passwords.
Is it going to be good for the phones and stuff that you have already? I noticed they said something about the iPhone 14, which is not here yet. So,
well, I tell you, I don't know how soon this will appear, because we know that it's applicable to Apple as of